Welcome back to the Dr. Dallas Unleashed podcast. It's been a while, but we are back, and I am Dr. Dallas. We have here Christy with us. She's
Hello.
our social media coordinator. Good to have you today.
Thank you for having me. I'm
Yeah.
excited.
I'm excited, too, to bring it back and start talking about plastic surgery, different topics, everything from what's going on in the world in plastic surgery, cosmetic surgery, pop culture, dating,
Yes.
and what else?
Oh, God. We have so many to talk about.
A lot of different topics. But today we wanted to go over one really good topic. I think something that we hear about and we try to help our patients all the time is how do you get the right size? How do you get the right implant size and choose it for yourself so you'll get the desired look that you want? So we hear that a lot, right? You know, I want to be, maybe a D cup. And someone will come in and they say, well, I don't want to look too big, too top heavy. I don't want to look like a porn star. So I said, okay, that's great. We'll make you look natural. But then they show us pictures and they're porn star pictures.
Yes.
So,
Goodness.
it's something that we run into. Do you kind of hear the same thing when patients talk to you about it or?
I do. They're like, oh, I don't want to go too big. And then I'm like, okay, send me your wish photos. And then it's literally 90s porn star.
Right.
And I'm like, okay.
And I think it's this, sort of ethos or, they don't want to, there's such a negative stigma of looking so big, so fake. But I think that's sometimes what people really desire. And so I see the struggle when someone comes in, especially moms who perhaps married with children, run around in groups that might poo-poo plastic surgery a little bit, like, why are you doing this to yourself? You don't need to do that. Your body's perfect. But they want to look better than they were before maybe having kids. And they don't necessarily want to say they want to look really big like that, but then they show us the pictures and it reveals that, oh, yes, they want to look very augmented. And when I say augmented, they want that high upper cleavage, right? That definition, that line that you can almost see, the edge of the implant. They want that line that you can see for the cleavage. And of course, they want that side boob. And so they'll be like, this is natural for me. And so that's kind of funny because it's not really that natural. And I would say to get that type of look, unfortunately, you have to be very, very thin because your own tissue can be really thick and it can camouflage the implant. And so let's say someone's a little bit overweight. And I'm not saying a lot, but it's really hard to get that sort of definition. So that's one of the things I do when patients come to me and they ask about having a certain look. I say, I don't know if I can do that with your body. So I think that's important to make sure that we're setting realistic expectations. So maybe you can kind of tell us when someone comes in, what are some of the things that we do to kind of help them start sizing? Once they tell us the size they're going to be or want to be, where they're starting, what are some of the things that we ask them to send us?
I do know that you want them to send like wish photos, but when they do come in, we actually have those inserts. Right,
for the sizing.
Yeah, for the sizing. And, once we have them measured, or do you like that size? Do you not like it? You can either go bigger or smaller, just so that you can see what you look like in the mirror, just as reference.
Exactly. So that's, one aspect is going to be, we ask them to send pictures of what they want to look like. And we ask them to send a picture of someone who looks similar to them in body frame. Maybe height, but I think most importantly is their sort of body structure, how thin, how athletic, maybe a little bit overweight, because that'll give us a little bit more realistic picture of what they could look like once we put in the implants. So that's one part of the process. And you were talking about our sizing, and there's a whole long history of sizing. Back in the old days, you know what they used to do?
What?
They used to get balloons and fill them up with rice.
Are you serious?
Yeah, fill them up with rice and, just kind of get a sense of like, okay, this is about 200 cc's worth of silicone or saline and size these sort of bags of rice inside people's bras.
Oh, wow.
That's how they did it.
Interesting.
Now we're a little bit more sophisticated. We've moved over to actually just taking these implants that the companies have given us and putting them inside their bra. And so that can help quite a bit too.
Okay.
And I think with a little bit more sophistication, some of the companies have come out with these inserts. I think they kind of, how would you describe them? You've seen the inserts. They're kind of...
they look like very teardrop shaped, but
Right.
it's like flat on one side, so that way you can press it up against your breast. And then the other side is like basically the size that you want. And then you just, I think you put it inside your bra or something, or you just
Yeah.
put it,
It's almost like
yeah.
something you could wear if you went out or something, right? Like you could
Yeah.
almost say, okay, I'm going to go up and, a cup size with these inserts. It actually hugs your breast a little bit. So it has that shaping on the inside that's a little bit concave. On the outside, it has that convexity of a breast.
Yes.
And the companies know how much that volume is. And, they'll put 300 cc's, 350. So I think that's gotten us really close to sizing appropriately. So when we have the patient put these on, then we know, okay, they like 300 cc's. They might like 400 cc's. So that's what I'll use once I go to the operating room is what they like, and we give them a range. We like to know kind of between 350 to 400 cc's. That helps me to have those implants available and the pictures of how they want to look.
Yeah. I want to say one thing that I remember is we actually had a patient and she wanted to go big, big. Like I think she wanted like 700 cc's. I was like,
Right.
oh, that's big. But then when you actually put it in her, she looked really good. Like
Yeah.
it was proportionate to her body.
And I think that comes to when I examine the patient, I measure different distances between, let's say, the sternal notch, that little point right here below your neck, the little dip. I guess it's right above the top of your sternum down to the nipple. That's a size or a distance I want to know. Really importantly, I want to know the base width, and then I want to know the distance between the nipple to the fold. So I think actually those two last are really important because if someone wants a very tight cleavage, I need to make sure I fit that base width, right? If I do a very narrow implant and I don't have it right because I didn't understand how long my distance was, we're going to get an implant that's sort of maybe off to the side a little bit, maybe moves too much, but we don't have that nice cleavage. So you need to fill it up so the implant's, properly placed and it's not sliding over. And the distance between the nipple to fold, now that's a set, I can't make that much bigger or smaller, but that tells me how much sort of under boob they're going to have. People kind of want that under boob.
Yeah.
If someone is really tight and small, I'll tell them you're not going to have that big, huge under boob unless that skin stretches a little bit. But I don't want to say for sure it's going to happen. So, we kind of give them realistic expectations that if it's a real small, let's say 4 centimeters, and they're showing us pictures of porn stars with like 20 centimeters because they have a huge amount of underboob. It's never going to happen.
Yeah.
And so I think that's how you're going to be successful with sizing is because you let them know, I've done these measurements. I understand what the implant will do once it's inside, and I know it's going to stretch or not stretch. And in this particular person who maybe never had children, that skin's tight and it's not going to move. So wherever you put that implant, it's probably going to sit right there and not move as long as you've measured it properly and then chose the implants, appropriately as well.
Yeah, there's a lot to think about. Like for someone like me that's not in the plastic surgery world, like I'm not a doctor, I'm not a nurse, whatever. I just do social media. I'm just coming in here and I'm like learning a lot of things, and I never knew what all went into just doing boobs. Like getting
Right.
breast aug, like, oh yeah, you have to measure. And then depending on your size, just because your friend Abigail is wanting 400 cc's, you want 400 cc's because it looks good on her, but your body frame is so different. And like to me, it opened up my eyes. I was like, oh, okay, so maybe I just can't be stuck on the number, but more, it's better to just send you photos of what you want to look like.
I think that's really important because when I make those measurements, it's also telling me there's a matrix of all these implants. And you've seen those booklets, right? Where it has low profile, medium profile, high profile, which means the projections, how much the implant moves forward, in addition to how wide the base diameter is. And there is in that matrix probably hundreds of different combinations. And so some people will come in and say, hey, I heard about the high profile. My friend has a high profile. I think that's what I want. And what I'll tell them is, I can kind of judge from your skin what sort of dimensions we should use. And typically, for you, we might use a moderate profile, or you would be great for a high profile. So I don't want to put it in the hands of the patient because it is very, very confusing. So it should be my job as the doctor to say, you know what, you like this picture. I think a high profile with this many cc's will give you that or a moderate profile with this many cc's will get you that, because it is really hard for them to kind of figure out if they get stuck on, okay, I need a high profile, it has to be 600 cc's. It may be really, really big on their body. And when that implant is too wide and it bottoms out because it's too heavy, now you
Mhm.
got a problem.
Yeah.
And it's not so much the patient's fault, but it's your fault as the doctor for not saying, let's back up a little bit. This is why I chose this. So,
Yeah.
yeah, it's important to kind of let them know that I try to take some of that decision making for me because I've measured the skin, the distances, and understand what's going to happen in that particular person.
Yeah, because a lot of times some girls, they're just, I just want boobs, make it happen, and then they don't think about the consequences. Like,
Mhm.
oh, maybe I went too big, and now it
Yeah.
just doesn't look how I envisioned it. You know?
Right. And
So
then some people get really not so much, I would say, stuck on a particular, size or profile, but they like this picture because it's got a lot of definition, a lot of cleavage.
mhm.
And what if someone, and I get this a lot, they go, I don't want my boobs to look like they're far apart. Most people have sort of, I would say, normal breast where the cleavage is pretty normal, maybe a couple inches apart, but there are some people with very wide cleavages. And those are the people we have to tell, well, I don't think, if you're looking at this picture and don't like it, it's not because the doctor put in implants because he just wanted to put them really wide. He's trying to give you some additional cleavage, but he can't go too much because the nipples are also in a certain position. So imagine this. What if you forced the implants to be really close? Well, if the nipples aren't used to being in that centralized position, you're going to have walleye
Oh
breast, right?
yeah. Oh
Because,
wow.
and then so you try to overcome that with a really wide implant. Well, now you might be in a much bigger implant than you really wanted to if they just wanted to go up a cup size. So there's a lot of, ways to help improve cleavage in someone who's got a very wide cleavage, but you also have to talk with the patient that it's not going to be perfect. It may not be that cleavage that she's looking at, but I can make it better. And that's what I try to do. I try to say, you know what, I can't copy that, but I'm going to get pretty close. And there might be a few instances where I tell people, I don't know if I can even get that close. We might have to set ourselves down a little bit
Yeah.
and go for the smaller implant, smaller size, and know that the cleavage won't be like that just because your own anatomy is different.
At least you're honest about it. I know there's some surgeons,
Mhm.
they'll say yes to anything, and then
Yeah.
sometimes it doesn't work out. But you're
Right.
honest with them, and you're like, hey, unfortunately, I can't do that, and that's what
Yeah.
a lot of people like. They want to be told the truth.
Yeah, there's kind of three schools of thought, but the two main ones are going to be you go to someone and they say, you know what, I am going to go purely by the measurements. Your base width is 11 centimeters, so I can only go that big. I won't go any bigger, I won't go any smaller, and your skin is not stretchy enough. It's a little bit too tight, so it cannot put in a high profile. So, according to my matrix, you're going to be 250 cc's, and she's an A cup. And you're like, well, I can only get you up to a B cup. Sorry, that's the best I can do. So they're very strict with the rules and don't want to overcome the dimensions of the breast, which is a very conservative way. But I think that you can move a little bit and go a little bit
Mhm.
bigger and accommodate for some stretching of the skin. So I'm sort of more in the middle where I follow the rules, but if they want to go a little bit bigger, I'm certainly okay with that. But I'm not on the other side of the debate where, oh, you want 600 cc's and you're 19 years old and 100 pounds with an A cup breast. I can put in a 600 C. No, you're going to stretch that skin, probably give some stretch marks, and
Mhm.
run a really high risk of bottoming out or implants moving around because they're
Mhm.
very, very big and very heavy. So there's some people who just push in whatever, which I then think you're going to see a lot of revisions and a lot of
Yeah,
problems.
I've seen it. Like even some of my friends, they went too big, and then now they're just all droopy, and it just looks not good on them.
Yeah. They've stretched the skin, they've hurt the skin, and it's hard
Mhm.
to get that skin to come back. So
Yeah.
it's just like the tummy, right? You have a baby, you stretch it out, and there's stretch marks. Once you have the baby, the stretch marks don't go away, and the
Yeah.
skin probably still a little bit loose. So once you've done that to the architecture of the breast, which is the inside, and then also to the outside skin, it's not going to go back even if you remove the implants. So
Yeah.
it's a sort of tough thing, and it's hard to tell which surgeon is going to be what. But I would say you have to visit people and get a sense of, hey, is this person honest? He's telling me, hey, don't go too big, but I can get close to this. I think that's where you're going to be, that happy medium,
Yeah.
because being too strict with it is like, okay, there's a little bit more, I think, art that you can do with it. And if someone says, oh, you want 800 cc's, we can do it, no problem. I'll schedule you tomorrow. Then I would also say be careful of
Yeah.
the person like that too.
Yeah.
But it's not an exact science; it's an art form. So when you do implants, other specialties, or even plastic surgeon, cosmetic surgeons might look at us and be like, "Oh, that's just an easy surgery." I'm used to taking out gallbladders and all that. That's really hard. But it is so easy; it can be hard, and you can mess things up really, really quickly. So, everything from dissecting the tissue because you put the implant underneath the muscle or on top of the muscle. That's a whole different topic too. But
Mhm.
creating a pocket that's safe, not opening the pocket too laterally. So when they lay down, you don't want that implant moved to the side. You got to be careful with all the bleeding that can occur near the middle, near the sternum. So all these things you want to be really careful with because if you have a lot of bleeding and those sorts of things, you can run into problems. And so, yeah, you just have to be really safe. And, if you know what you're doing, it's an easy procedure. If you don't know what you're doing, you're going to have a hard time.
Yeah, and I think another important thing would be like the post-op care. So, you can tell them everything in the book, but if you're not following up your post-care instructions and you're not eating healthy and you're not doing the right things, it could actually mess up, some of the incisions or.
Yeah, I think, we give people post-operatively one, a surgical bra. So they have to wear the surgical bra for usually a couple weeks. I typically use the little incisions in the crease, although you can use it around the areola, sometimes the armpit. I don't do the armpit incisions, but whatever it is, we put little steri strips or Band-Aids over those areas. They can shower the next day. Of course, you want them eating healthy, but I think really importantly, they need to take the medications we give them.
Yes.
That's because one, it's an antibiotic to prevent any infections. The other one is pain medications, usually in the form of a light narcotic and a muscle relaxant, because that's why breast augmentations are uncomfortable. You're stretching that muscle because typically we place the implants underneath the muscle, and that's happening the majority of the time with augmentations done throughout the world. And so that pain is the pain that needs to kind of subside before someone feels like they're ready to go back to work, lifting things. Our particular protocol is take it easy off work, usually about 4 or 5 days, and then they can start working out, meaning flexing that muscle, up in the upper chest in about 6 weeks.
Yeah.
And so you might hear like a rapid recovery breast augmentation. Have you heard that
No,
before?
what is
Okay.
that?
So I think it's more of a marketing thing because typically you are marketing to people, hey, come to me. I can get you a breast augmentation and you can go out to dinner that night. Well, I
Oh,
will tell you that that doesn't always happen. And what they're trying to do is one, they're probably injecting a lot of pain medication into the pocket, which is fine. We do that
okay.
as well, but they're
Okay.
usually going above the muscle. So
Okay.
above the muscle, guess what you're avoiding? Cutting the muscle, stretching the muscle. So it's just underneath the gland. And so there's really, I would say, kind of moderate to minimal pain because you're not dealing with the muscle.
Mhm.
However, you can still have pain with that.
Mhm.
So I find it a little bit kind of tricky because you're hoping that everyone has a rapid recovery, but out of every 10 patients, you're going to get 2 or 3 that are not very happy because they're in a lot of pain for whatever reason,
Yeah.
bleeding, bruising, that sort of thing. I would say because I'm very meticulous with our breast augmentations, I don't create a lot of bleeding. Dissection is very clean, that even with underneath the muscle, our patients rebound very quickly. So, but I don't like to say rapid recovery because that might not be true in everybody.
Yeah.
So you're going to get 2 or 3 people mad all the
You're
time,
giving them
every
that
10. So
expectation already.
I like to tell them this is the worst that can happen. And then when they feel really great, they're like, oh man, this is even better than what I thought.
Yeah.
Rather than overpromise and underdeliver,
Mhm.
sort of underpromise and
Over
overdeliver.
delivery. Yeah.
Yeah.
That's
So,
always good. I like that mindset.
so But yes, I think that's breast augmentation, how we size, the philosophy behind sizing, and how strict you want to be with a patient, and how you can achieve the results. Overall, it's a very complicated process. It's not just you come in here,
Yeah.
wham bam, yes, we'll do this. You're on schedule for next week. There's a bit of a process, and you want people to understand what they're signing up for, and also understand what it will be like post-operatively, and then also temper their expectations. So, all that is just part of speaking with people and being honest, and then also having good support people, because I don't talk to them a whole bunch once they start scheduling surgery because I see them at the consultation and then pre-op. But it's our girls who then talk to them getting ready with their medications, who are really important points of contact in the office to make sure that process goes really smooth.
Yes. I think that's great. I love the girls here. They're so sweet. And, I always have a lot of questions, like if I ever want to get my boobs done, and they help me a
Yeah.
lot.
Sometimes people come in and I'll look at my schedule, it'll say breast augmentation consult. And they'll come in and they'll be like, yeah, I just want to look, have this look where I have that definition. But really what they need is they've had children, they need the breast lifted, they actually need a reduction because
Hmm.
it's so heavy. And so you end up getting to talk into a lot more different things with as far as what they need, because it might be a breast lift and maybe a small reduction and perhaps an implant down the road.
Yeah.
So those are all things that we go into if they need a little bit more than just a simple breast augmentation.
Yeah.
So
That's great information. Well, thank you so much.
yeah, so that's what we're talking about when it comes to breast sizing. It's a really, I think, interesting and fun topic, something that I took a long time to sort of learn and sort out. But I think, here with myself and Dr. Dallas and our staff, we really have it down and we can really give patients the experience that they want and the results that they want.
Yeah.
So yeah, happy about that. And it's great for people. Hopefully they can get a lot out of this.
Yeah.
And if they want more information, I got to call. I got to make that appointment.
Yeah. Give
Yeah.
us a call. It's 469-234-8890.
All right. We'll see you guys next time. So we'll have some great topics. But until next time, this is Dr. Dallas Unleashed with Christy.
Bye.
Bye.